The disease that I have is described as multiple myeloma. My condition had deteriorated to where, I was dizzy, uncomfortable walking, using a wheelchair.
Walt came to us as a referral from a family member that wanted us to evaluate him for a second opinion. Walt was anemic. He had low red blood cells, which was causing his fatigue. He also had obvious bone involvement of his spine as well as in his pelvis.
I have 5 spots. The original spot in my back at the L1 vertebrae is where I was being treated for a compression fracture. There's a tumor there, and then I've got 2 on each hip.
Walt's compression fracture, I believe, was more of an alarm symptom that there was more serious disorders occurring. All of us get aches and pains from time to time, but what makes Walt's symptoms a little more concerning is that they began and they progressively worsened over approximately a 2-month period.
On a Friday morning at 8:30, I was in Dr. Faber's office at the Nebraska Medical Center, and things began to turn for the better.
Given his pain and the degree of fractures in his spine, it was elected for him to undergo the surgical procedure to stabilize his spine by Madhuri Are for not only immediate pain control, but also for long-term stability of his spine.
On a Wednesday, I had the procedure and woke up with immediate back relief. The thing that is so dramatic is that when I got to Dr. Faber was the immediate urgency that was put to me, the time spent, no, no rushing, I've got to get to the next patient, will take as much time, here's what you're looking at. Dr. Faber's ability to pull people together and look at the whole situation has made an incredible difference. Cancer, and not having any experience with it, it's scary. It's scary as can be. And you're going, oh boy, what's gonna happen next? What's chemo? You hear all kinds of things about chemo. Let's see, so far counting today, I've been through 14 chemo treatments, 4 more to go. I'm looking forward to my chemotherapy. And people go, what? I go, yeah, I really am. I mean, because it's gone that well.
Traditional chemotherapies usually involve lengthy infusion times in a treatment center. These novel or new agents that Walt is receiving, one of them is a pill similar to a blood pressure medicine or a multivitamin. The other is a quick injection in our treatment center.
I've heard about it all my life, the wonderful work, that's done there, but I've experienced it, and I'm here to tell you it's true, and that word needs to get out, and that's why I'm here right now.
It's extremely gratifying when we are able to improve someone's overall being, their quality of life.
Whatever the illness, you need to get with cutting edge, you need to get with the best, because there's such a big difference.